Hi, my name is Andrew Phillips. I'm the founder and editor-in-chief of EM Coach. So for this particular question, I think it's a good example of looking for the constellation of symptoms. The most classic question you'll usually see with methemoglobinemia is a presentation with some kind of topical anesthetic or an intradermal thing, like too much lidocaine, especially if you go to the 2% or something like that, or some kind of cardiac lidocaine, some kind of toxicity from an anesthetic. Or someone, maybe another classic way that the question will be phrased is a young child who is teething, gets a lot of benzocaine on the teeth for the gums, right, and then comes up with methemoglobinemia. But it can be caused really by anything that's changing the ferrous and ferric state of the hemoglobin. So poppers are any kind of it's a slang term for a class of medications of amyl nitrates, and there are different versions within this drug class, which again makes it difficult when you have ingestions, because what exactly do they take? The other issue with poppers is that in order to evade authorities, these drugs are often camouflaged as something else. So a lot like bath salts, right, or sometimes often advertised as actual bath salts, but not intended to be put into the water. So too, these poppers are often advertised as something else, like a shoe polish or even a tape head cleaner, but actually are intended as that drug to be ingested. So the trick is to look for the constellation of symptoms, and in particular, if you're having methemoglobinemia, you can expect to see that standard 85-ish% on your pulse ox, and it's not going to be reflective of your PaO2. It's going to hold right around 82, 86-ish%. It's going to look like that chocolate brown blood, and they're definitely going to be showing shortness of breath, and it's going to be refractory to oxygen, which would be atypical, right? It's more exemplary of a metabolic process in which the extra oxygen is not actually helping the person with their hypoxemia. So keep methemoglobinemia in mind when there is suspicion for some kind of toxic ingestion, and it doesn't matter what particular type of amyl nitrate it was within that class, because it's still going to be producing that methemoglobinemia, and the treatment's going to be the same. So whether it's a popper, whether it's advertised as some kind of weird shoe polish, the drug and its effects is going to be the same, and the important part is to look for that constellation of symptoms. This is Andrew Phillips, the founder and editor-in-chief of EM Coach. Thank you for watching.